as far as autism spectrum disorder is concerned, there were approximately 10 headings. Do you remember that? So we finished up to clinical features. Or diagnosis. So I am left with differential diagnosis, comorbidities, reorienting you to the last lecture. So comorbidities, prognosis, then subtypes and management. So are you oriented back that we are supposed to discuss these 5 headings today? Yes, are you oriented? Is my voice clear? Is my audio clearly visible? Are you all here? Just give me a yes, no, and I shall be satisfied so that I can proceed ahead. Let's go ahead. Differential diagnosis in autism spectrum disorder. Number 1, social or pragmatic communication disorder. Number 2, childhood onset schizophrenia. Number 3, language disorder. Number 4, congenital deafness. Or hearing impairment. Number 5, psychosocial deprivation. And number 6, intellectual disability with behavioral abnormalities. You have been a student of child psychiatry course since last 3 lectures, and if you remember that we have been discussing neurodevelopmental disorders since last 3 lectures. The first lecture was intellectual disability, that's the first neurodevelopmental disorder. The second lecture was your communication disorders, in which we discussed about language disorder as well as social pragmatic communication disorder. And in the third lecture we started autism, and this is lecture 4. So when I discussed with you the communication disorders, at that time also I mentioned that we are supposed to read a communication disorder to be able to differentiate it from autism. If a student has read DSM-5 or a latest edition of Kaplan Synopsis 11th edition onwards and CTP 10th edition onwards, his first answer to autism differential diagnosis will be social and pragmatic communication disorder. But if a student has read older books, his first answer will be childhood onset schizophrenia. So it is very easy for examiner to identify that whether your knowledge is updated with DSM-5 or not, because social and pragmatic communication disorder was not there in DSM-4. So suppose you have read some older book. So I ask you, name the number 1 differential diagnosis of autism. Your answer would be childhood onset schizophrenia. But If you have read DSM-5, your answer would be social or pragmatic communication disorder. And now I am going to ask you a question. I want to make this class interactive. So, do you remember I taught you in communication disorder in the second class on child psychiatry, the last topic, that social or pragmatic communication disorder is the closest differential diagnosis of autism spectrum disorder with only one difference. What is that difference? Can anyone tell me? What is that difference? How will you differentiate social or pragmatic communication disorder from autism? A very, very important point. Can anyone answer? Come on. Come on, come on. Anyone who can answer this? Do you remember the two core components of autism? One was impairment in social communication and interaction, and second one restrictive repetitive stereotype pattern of behavior, interest and activities. So how would you differentiate a pragmatic communication disorder with autism spectrum disorder? Do all of you get it? Krishnendu, very good. I'm happy that at least you are remembering this. Are you people even revising notes? I'm not sure, because I believe whatever I'm going to ask you will be from the areas what I have already taught you, not from the areas which I haven't taught you. Have you read these topics from textbooks, whatever I have taught? Are you understanding the lectures? Because if you are understanding, you should be able to answer. So childhood onset schizophrenia versus autism spectrum disorder. There is more possibility of perinatal and prenatal history in autism spectrum disorder, more of intellectual disability, more of seizure, as compared to childhood onset schizophrenia, where all these are less, but a positive family history of schizophrenia is more likely in childhood onset schizophrenia. Very good, very good. Most of you have answered it correctly. Saptarshi, Nishan Saha, Anu, very good. Anupama, Lakshmi, very good. Dhwani, S.A. Karthika Sanhari, very good. The moment you say about social pragmatic communication disorder doesn't have RRBs, the examiner is impressed that you have read synopsis 11th or CTP 10th or DSM 5. I gave my MD exams in 2015. So in that year, just 1 year before that, or 1.5 years before that, synopsis 11th arrived. So if anyone was able to answer as per synopsis 11th or CTP 10th, I think came after I passed MD. So if anyone was able to answer as per the latest book, it was credited. Do you understand this? So I have read this topic from CTP 9th as well. In CTP 9th, the first DD is given as childhood onset schizophrenia. Do you get it what I am telling you? So please say the first DD as social or pragmatic communication disorder. Can anyone tell me how will you differentiate language disorder versus ASD? Have I taught you language disorder? Have I taught you language disorder in the last lecture? How will you differentiate language disorder versus ASD? ASD has both verbal as well as non-verbal communication affected. Language disorder, verbal more affected, non-verbal less affected. It's not that in language disorder, non-verbal communication will not be affected. So, communication is verbal as well as non-verbal, both body language, emotional. So the non-verbal component is more so affected in autism and less so in language disorder. You get it? Now, congenital deafness or hearing impairment, these children respond to loud sounds sometimes because they are hearing impaired. You might feel them as autism, but autism, if you remember, they are hyporeactive to loud sounds and hyperreactive to low sounds. So they have differential reactivity to the sensory stimuli. Do you remember? That's one of the clinical features of ASD, hyperreactivity to sensory stimulus. So congenital deafness versus autism spectrum disorder. Children respond to loud sounds. Autism spectrum disorder are hyporeactive to loud sounds and hyperreactive to low sounds. Psychosocial deprivation. These are the children who are suffering of maltreatment, parental neglect. That's why they show signs similar to autism spectrum disorder. But when you change their environment to a better and more healthy social environment, the symptoms improve. Versus in autism, there is no effect of changing environment.